Hello, Dr. Abdulhadi here. In this video, I will teach you some really high-yield concepts about the subject of diastolic heart failure. Let's go to the board. So, heart failure with preserved ejection fraction, HFpEF, or also called diastolic heart failure. This is the syndrome of heart failure when the ejection fraction of the heart is more than 50%. And clinically, it may be indistinguishable from the heart failure with reduced ejection fraction. However, in clinical practice, there are some differences, and in the exam, they will focus on these and they will ask you about them. So I have designed a question here. Usually, the question will come this way. It's a 65-year-old female who has history of diabetes type 2, hypertension, her BMI is 32, and she has chronic kidney disease stage 3, her creatinine is 1.5. So you can see they're paving the way, they're giving you the risk factors, and then they will give you the symptoms. They say this patient presents with maybe a week of worsening dyspnea on exertion or shortness of breath on exertion. She has bilateral lower extremity edema. She has elevated jugular venous pressure, and on the blood work, she has elevated BNP. Look, what they want to tell you is that there is pulmonary edema because the patient is short of breath. There is systemic congestion, bilateral lower extremity edema. There is jugular venous distension, and on the blood work, her BNP is elevated. So I found that the most common question that comes for the subject of diastolic heart failure is that they give you this presentation and they will tell you what is the best next diagnostic step, because they want to prepare you for the clinical practice when you're a resident or when you're a physician. You know, when you have a patient like this, what next test will you be doing? Are they going to say, are you going to do a pulmonary function test, thinking this patient is having shortness of breath, maybe COPD? Are you going to do a 2D echo? Are you going to do a stress test because she has dyspnea on exertion? Or are you going to do a CT pulmonary angiogram to rule out pulmonary embolism? Although all of them, they have some, they make a little bit of sense, but the next best diagnostic step is you have a syndrome of heart failure in a patient with these conditions. So you want to pick up the 2D echo. And the 2D echo will usually give you the result because it will show you findings that are suspicious for diastolic heart failure, especially the EF will be more than 50%. And that's what they want you to know. Now, there is another question that I guarantee you will see on one of your exams, because the new studies are showing that the one medication, the SGLT2 inhibitor, for example, Jardiance, which is primarily a treatment for diabetes, one of the treatments for diabetes type 2, it was found that even in patients without diabetes, it is shown to decrease hospitalization and decrease mortality. And exam question writers, they like nothing more than things that decrease hospitalization and decrease mortality because it saves lives and it saves money. So SGLT2 inhibitor, for example, you have one of them is Jardiance or empagliflozin. This medication is shown to decrease hospitalization and decrease mortality in patients with diastolic heart failure, even if they do not have diabetes. So the same question that it was showing to you before, they will give you the echo also. They say the echo showed left ventricular hypertrophy and the EF is more than 50%. Pick one of those treatments and they will give you a bunch of things. They are not going to include Lasix because Lasix is one of the core treatments. They will include distractors, but one of them will be empagliflozin And I want you to be aware that you will be tested for this concept, because SGLT2 inhibitor, again, medications like Jardiance, are shown to decrease hospitalization and mortality in patients with diastolic heart failure. If you like this video, like it and share it with your friends. And thank you so much.